everybody. I'm Sarah Williams. I'm a board certified psychiatric mental health nurse practitioner. And today I'm going to talk about a mental health topic called anxiety and what it is and what causes it.
Is anxiety. Anxiety is the mind and body's response to perceived stress, danger, or uncertainty. In its most basic form, anxiety is not actually a bad thing, it's a part of being human. Anxiety is connected to our survival system, and it's actually the body's way of trying to protect us. For example, if you were walking across the street and you suddenly saw a car coming at you too fast, anxiety would be helpful because your body would react quickly, your heart might race, your muscles might tense, you are going to try to get out of the way of the car as fast as you can. Your breathing's going to change, your mind becomes alert, and all of that is designed to help you respond to a threat. Obviously, that kind of anxiety is normal and protective. Because if we just saw a car coming and we just stood there nonchalantly acting like we weren't about to get hit by a car, that would not be a good thing. However, the problem is that our nervous system does not only react to physical danger, it can also react to emotional stress, uncertainty, social pressure, health worries, conflicts in our relationships, financial stress, trauma, major life changes, and even our own thoughts. So, even when there's no immediate emergency, the body can still respond as if something is wrong. That's why anxiety can feel so real and so intense, even when you logically know that you're not in immediate danger. Most people think anxiety is just worrying, but sometimes it's a lot more than that. Anxiety can affect thoughts, emotions, behavior, and it can have a lot of physical symptoms. Mentally, anxiety may look like constant worry, racing thoughts, overthinking, fear of something bad happening, difficulty concentrating, or feeling unable to shut the mind off. Emotionally, it may feel like dread, irritability, restlessness, panic, or a constant sense of being overwhelmed. Physically, anxiety may cause a racing heart, tight chest, upset stomach, nausea, muscle tension, sweating, shaky feelings, feeling dizzy, headaches, fatigue, or even insomnia or difficulty with like falling asleep. Sometimes people are surprised by the physical symptoms. They may think something is seriously wrong with them physically when their nervous system is activated and their body starts acting like that, like it's sounding an alarm. So, why does anxiety happen? Well, there's not usually just one reason. It's often a combination of factors. One factor is biology. Some people are just more biologically sensitive to anxiety. Their nervous system may be more reactive, or they may have a family history of anxiety or other mental health conditions. Genetics don't determine everything, but I do believe that they play a role. And I'm going to get a little nerdy here now because another helpful piece of understanding anxiety is knowing that brain chemistry also plays a role. Our brains use chemical messengers called neurotransmitters to help nerve cells communicate with each other. These neurotransmitters help regulate our mood, alertness, motivation, sleep, stress response, and emotional balance. Anxiety isn't caused by just one chemical in our brain, but several neurotransmitters are involved. One of the main neurotransmitters that people often hear about is serotonin. So, serotonin regulates mood, sleep, and overall emotional stability. When serotonin signaling is disrupted, some people may experience more anxiety, irritability, worry, or mood symptoms. This is one reason some medications used for anxiety and depression work by affecting serotonin in our brain. Another important neurotransmitter is norepinephrine. It can also be called noradrenaline, so you might have heard of it called by that name. So, norepinephrine is involved in the body's alert system. It helps us respond to stress and can increase our attention and arousal. But when the system is overactive, it can also contribute to symptoms like feeling keyed up, restless, jittery, or on edge. It can also play a role in physical symptoms such as racing heart or shakiness. GABA, which stands for gamma aminobutyric acid, is another neurotransmitter in anxiety. GABA has a calming effect on the brain, and you can think of it as the brain's braking system. It helps slow things down and reduce overactivity in the nervous system. When GABA activity is too low or not working effectively, the brain may have a harder time calming anxious thoughts and physical tension. Dopamine is also involved, although people often think of it more in relation to motivation and reward. Dopamine can affect focus, drive, and the brain's response to stress. In some people, dysregulation in the dopamine pathways may contribute to feelings of unease, overstimulation, or difficulty regulating emotions. We can also think about glutamate, which is the brain's main excitatory neurotransmitter. That just means that it increases activity in the brain. Glutamate is an important neurotransmitter for learning and normal brain function, but too much, especially when not balanced by calming systems like GABA, can also contribute to anxiety and heightened nervous system activation. So when we talk about anxiety, we're not just talking about someone thinking too much or needing to calm down. Anxiety can involve real biological processes in the brain and body, including how these neurotransmitters are functioning and how the nervous system is responding to stress. I always use with my patients the example of if you had a friend with, let's say, type 1 diabetes. We know that an organ in their body is not working correctly and not creating insulin, and therefore they have to give themselves insulin, sometimes even just to stay alive, because we need insulin. And you have to remember that the brain is also an organ, and sometimes it doesn't work correctly, or there's something not quite right in some of our pathways or our neurotransmitters. So just remember that your brain is an organ, and sometimes it's not going to work correctly either, just like our gallbladder can quit working, or our pancreas, or our kidneys. At the same time, brain chemistry is only part of the picture. Neurotransmitters interact with sleep, stress, trauma, hormones, all of the things. And that's why anxiety is usually best understood in a whole person rather than just like by one chemical imbalance. Stress plays a big factor. When someone's under stress for a long period of time, the nervous system can become overworked and therefore easily triggered. Chronic stress can make the body feel like it has to stay on alert. Past experiences also play a role. Trauma, painful experiences, instability, loss, and going through these highly stressful situations can shape how safe or unsafe the world feels to our mind and body. And sometimes anxiety develops because the nervous system has learned to stay prepared for danger, even when danger is not present in the moment. Thought patterns can also fuel anxiety. If someone tends to expect the worst, overanalyze situations, fear uncertainty, or constantly scan for what could go wrong, anxiety can often grow stronger. So the mind is trying to protect the person, but it can get stuck in a pattern of overestimating threat. And this is why a lot of times therapy is recommended for anxiety with or without medication options, because sometimes we need to reframe our thinking or challenge our negative thought patterns. Lifestyle factors matter too. Lack of sleep, too much caffeine, chronic overstimulation, poor boundaries, lack of downtime and self-care, or not fully recovering from stressful situations can make anxiety worse. When the body is depleted, the nervous system can become more reactive. Um, and another important thing that I wanted to mention is that it's important to understand that anxiety feeds off of itself. So let's say you start to get anxious and your heart starts racing. Well, then that can scare you because you're like, why is my heart racing? Is there something wrong with me? And then you become more focused on that sensation. Fear increases your anxiety, which makes your heart race more. And then it's just a cycle. Especially with people who are prone to overthinking. You worry, and then you worry about how much you're worrying, and then you worry about the physical symptoms, and the cycle just keeps going. And that is a reason why anxiety can feel so exhausting. It's not usually it's not just about one single fear. It's a loop between thoughts, body sensations, emotions, and behaviors. Sometimes anxiety becomes a problem to the point that it leads people to avoid things that make them uncomfortable. They might avoid social situations, hard conversations, public places, phone calls, driving, anything that makes them feel uncertain. And that avoidance can bring some temporary relief, but over time it teaches the brain that the situation really was dangerous, which could make the anxiety even stronger if they are, faced with a situation like that in the future. Normal anxiety comes and goes and tends to fit the situation. Might be uncomfortable, but it doesn't completely take over. It becomes more concerning when it's frequent, intense, hard to control, or interfering with your daily life. If it's affecting your functioning, your relationships, your work, your sleep, it may be more than just everyday stress. It's important to also think or to know that anxiety doesn't always look the same in everyone. So, I mean, some people are better at hiding it than others. It can wear many different faces, but it is treatable. Educating yourself and learning to understand it can help you to manage it. But there's also therapy, medication, lifestyle changes, nervous system regulation skills. Um, you can try things like improving sleep, reducing overstimulation, learning healthier thought patterns, and working through your underlying stress and trauma. And honestly, therapy is a good place for a lot of those um, things that I mentioned. Healing from anxiety doesn't mean that you're never going to feel anxious again. It just means that anxiety will no longer run the show and that you can better manage it. If you struggle with anxiety, I just want you to know this. It doesn't mean that you're weak, broken, or failing. It's usually a sign that your mind and body are trying hard to protect you. So the goal is not shame, the goal is just understanding. When we understand it better, we can respond to it better. All right. Well, thank you for being here with me today. Like I said, I'm Sarah Williams, and this is Root and Rise, where we work to understand deeper and heal stronger.